Welcome to MindWaves, the official podcast of NYNO. Every day, millions of people live with mental health conditions, neurological disorders, learning differences, and invisible challenges that many of us never see. Yet, despite how common these experiences are, misunderstandings, stigma, and isolation continue to affect countless lives.
At NYNO, we believe that awareness creates understanding, and understanding creates compassion, and compassion creates change.
Our mission is simple but powerful: to make conversations about the brain and mental health more accessible, more human, and more meaningful. Through stories, science, and conversations with people who are making a difference, we hope to bridge the gap between knowledge and empathy.
Because when we understand the brain better, we understand each other better.
And when we understand each other better, we build a world where no one feels alone because of a diagnosis, struggle, or a challenge they face.
This podcast is for students, families, advocates, healthcare professionals, and anyone who believes that every person deserves to be seen, heard, and understood.
Today marks the beginning of that journey.
From our very first episode, we're honored to welcome someone whose work is helping make that vision a reality.
Today, we're honored to welcome Dr. Andrea Quinn to the podcast.
Dr. Quinn serves in a leadership role within Rutgers University's Psychological Services community, working both with the broader center in an administrative capacity and as the director of a specialty clinic that provides services to individuals and families. She is also an alumna of the Rutgers Graduate School of Applied and Professional Psychology, giving her a unique perspective on both professional training and the practical delivery of mental health care.
Through her work, Dr. Quinn has helped support the systems that connect people with psychological services while also contributing to the education and development of future mental health professionals.
In today's conversation, we will discuss her journey into psychology, the importance of accessible mental health care, what students should know about careers in psychology, and how greater understanding of mental health can strengthen our communities.
Thank you so much for joining us today and being a part of our very first podcast episode. And to start, could you introduce yourself and tell us a little about your role at Rutgers and the work that you do?
Absolutely. My name is Dr. Andrea Quinn. I work, for Rutgers University with the Graduate School of Applied and Professional Psychology. And I graduated from the program, so I'm a clinical psychologist. I've been working full-time at Rutgers for 20 years. And my job is actually, so I work for our training clinic, which is called the Center for Psychological Services. And it's basically the part of our program where the students who are in doctoral programs learning how to be clinical and school psychologists get hands-on experience. So it's where they learn how to do therapy because they take on clients or patients through our training clinic, and they might be doing therapy or assessment, or maybe they're helping people figure out if they have ADHD or learning disabilities, things like that. So my job in our training clinic, we have, our center is really large. And so we have kind of a general services clinic, an assessment clinic, and then we have a bunch of specialty clinics that work with maybe certain problems or certain populations or whatever. So my job is I'm the assistant director of our center. So I help with the day-to-day operations of everything. But I also run one of our specialty clinics, which is the anxiety disorders clinic. And so in that part of my job, I train and supervise graduate students who are learning how to do therapy for anxiety disorders and other sort of what we consider related disorders. Some of those are obsessive compulsive disorder and post-traumatic stress disorder. So the students do the therapy, but I supervise them on doing that. So that might mean like I watch videos of their therapy sessions. We have meetings. I teach them different things. We talk about our cases and things like that. So I have a lot of different components to my job.
Thank you. That was a great introduction to the work that you do. What first inspired you to pursue psychology, and was there a particular experience or moment that shaped your career path?
Good question. Interestingly, all the way back in the beginning, when I was an undergrad student, I was not a psychology major at first. I was a communications major. I thought I wanted to be a reporter or work in TV or something. In my university, there was a lot of opportunities for volunteer work. So I started doing a lot of volunteer work, after school programs with kids, outreach to the homeless, like Habitat for Humanity type stuff, building houses. And I think really it was that like I realized that I wanted to do something that would be like connected to people and giving back to the community. Um, and I think it was the work with kids, like working in these kind of mentoring after school programs. I would see sometimes that they struggle with certain things, but my job was like recreational or homework or things like that. And I would be thinking like, who's the person that actually gets to help with those things? And it just sort of made me start to think about psychology. I changed my major, and then pursued graduate school to be able to, just thinking about what role, what degree I might need to have to do the job I wanted to do. And to be honest, at the time, I don't even really think I understood different career paths. So I actually thought you needed to have a doctorate to do all the things that I was thinking I wanted to do. That's not actually true. But it has turned out to really work well for me because I have stayed in this sort of university setting where I do need that degree. And so that's kind of worked out for me. But it was all the way back in undergrad and sort of starting to think about service and helping others that kind of led me to do that. Um, I think, as is the case for a lot of people, the specific job that I have now was a little bit of like right place, right time. I was doing a different job, but working with people and just working hard in my job, trying to do the best job that I could, and an opportunity within. So I already worked for the Graduate School of Applied and Professional Psychology, but I was doing a little bit of a different kind of job, and they needed a director for the anxiety disorders clinic, and I applied, and I had like done a good job and worked hard, and people knew me, and I sort of shifted focus. When I was in graduate school, I was a lot more focused. So I'm working with kids and families exclusively. So the job that I do now is a little bit different than even what I trained for in graduate school. And then the other part of my job just came about because they needed assistance with running the center. And I was somebody who had been here for a long time and was knowledgeable. And so was able to kind of step into that role as well.
I know you mentioned like career paths, and we will be talking about that in a little bit. But also, I know you mentioned that you completed your graduate training at Rutgers. And so, what were the most, like, some of the most valuable lessons or experiences that helped prepare you for the role you have today?
Yeah, I mean, this program at Rutgers, we call it the Graduate School of Applied and Professional Psychology. We call it GAZAP. Um, GAZAP is the program is a doctoral degree, but it's a PsyD instead of a PhD. There is a PhD clinical psychology program at Rutgers also. It's a little bit more oriented towards research. The PsyD degree is like for folks who want to be practitioners. It's oriented towards clinical work. And so the model that they use is you start working with patients right from the beginning of your very first year. So, I had a placement in my first year that was working with children and families that were in like the foster care system. And it was very, very challenging and stressful. I was right out of college. So I was 22 years old, really young and scared and didn't know how to do anything and just felt very overwhelmed working with families with really complex problems and kids who had experienced trauma. But I think that first year was kind of transformative in terms of, graduate school because it had me practicing working with people right from the beginning and learning therapy skills. And because that first job was really challenging and difficult, I just think it gave me confidence that like if I could handle that, I could do it. Like if I could get through that, other things were going to feel easier after that.
As you know, we are a growing podcast, and we expect many of our listeners to be high schoolers and college students that are exploring future careers. And for someone who is interested in psychology, what are some different career paths that people may not know about?
Great question. Like I said, what I didn't know when I was a college student, um, was that there's a lot of, if people are interested in some of these careers that involve working with others, helping people, even doing therapy, um, going into it took me 6 years to get my doctorate after I graduated with my bachelor's. Um, there are lots of things you can do with a master's degree that are similar. So, a master's in social work, you can become a licensed clinical social worker and offer therapy in the community to people. You can become a licensed professional counselor, a licensed marriage and family therapist. Those are all master's level degrees. I think for folks who want flexibility to maybe be a professor or maybe be involved in training students, maybe like be on the board of something, the doctoral degree gives you a lot of flexibility to do a lot of different types of jobs, but it's one pathway. So a lot of doctoral psychologists provide clinical services, offer therapy. But that's not the only way to do that if that's what people are interested in. And then GAZAP also has a program in school psychology. So people who are interested in working with children and families, sometimes going into a school setting. A lot of our doctoral students are interested, maybe not even just being a school psychologist doing testing and things that folks on the child study team do, but doing school-based mental health, where maybe they work in a program that's in the school, like embedded in the school, providing mental health services and doing kind of like unique roles like that. So there's not that many of those types of programs out there, but I think they're growing. So I think that's something that a lot of our students are interested in as well.
So I know you mentioned there's like a lot of different things you could do within the field of psychology. So what's some advice that you would give to someone like a student who's like interested in psychology, but they don't know where to begin?
One of the best things that advice that someone can give you is if you hear about, like, think about the different types of jobs that people have in that field. And if you think what someone does sounds really cool, find out what their pathway was. Like, don't be afraid, as the two of you did, which I thought was really great. Don't be afraid to send an email and see if someone would be willing to like talk to you and answer your questions about like how did they like what did they need to do to be able to do the job that they have? Because you can find, like I said, you can find out that there might be different ways to get to that same, different types of degree pathways. Or, if someone said like graduate school was really hard to get into or something like that, even current graduate students could tell you what they did to make themselves stronger candidates. A lot of them go and do work and do other stuff for a couple of years, working on research studies, volunteering, working, in a hospital, just to try to learn and see what you like. And also, if you're thinking about graduate school, it gives you a lot of different things experiences that you can say that you've done that make you a really good candidate for those things. So I think, best thing, because there are a lot of things that you can do, is you know, like think about jobs or like listen to jobs or reach out to people and ask like what kinds of things do people in your organization do, and ask questions about how that person got to their pathway. A lot of people probably have stories like mine where some of it is your training and some of it is a little bit of like luck or right place, right time kind of thing. But it's good to know like what were the qualifications someone or the pathway that someone needed to take to land where they did.
Dr. Quinn, you told us a lot about your career path to become a psychologist. So, from your perspective, what are some of the biggest mental health challenges that young people are facing today?
Well, I mean, let me start with the my greatest area of expertise, which is anxiety. It is the most common mental health concern, broadly for everyone, but definitely for youth. Um, I think something like 15 to 20% of folks in that sort of child and adolescent time, like over their course of the lifespan, will be diagnosed with some kind or could be diagnosed with some sort of anxiety disorder. Um, I think there's reasons too why like mental health concerns are sort of increasing for children and adolescents. I think there's a lot of changes in the world now that I think there's just things that you have to deal with now that are different, I think, from what previous generations had to deal with. And some of it is, you have so much information. I think it's hard to process all that information. You know so much. And so I think sometimes people might have had a narrower view of the world when we had a little less information, from all of the internet and everything. So I think you have to try to like grapple with and understand a lot of different things. And it sort of gives people more things that they might feel worried about. I think, social media can be excellent, but it's also gives you a constant state of comparing yourself to other people, which I think can make things really, really difficult and can lead to some social anxiety and additional worries. So I think also depression and suicidality are very significant problems with children and adolescents. I think sometimes those feelings of being overwhelmed, having very, very busy schedules, sometimes, it feels like a lot of pressure. And I think um, kids and teenagers, they can start to feel kind of hopeless or that they're not doing enough, things like that. And it can start to feel some of those like low mood and hopeless feelings. So I think those are big problems that we have now.
Um, we were talking about at the start, we were talking about some of your areas of expertise, and like just now, we were talking about anxiety. And at the start, I think you mentioned OCD. So
Mhm.
could you briefly like explain what these conditions are, and then some of the common misconceptions people have about them?
Great question. I love to talk about common misconceptions with OCD because I think it's a lot of people know a little bit about OCD. Like it's enough in the media that folks know, it involves sometimes feeling like you want things to be perfect or redo things or washing your hands a lot or things like that. And so sometimes there can be this common misconception that somebody who's like, prefers things really organized or likes to color code their stuff or things like that. And people will say, oh my God, I'm so OCD. Like, do you see how OCD I am? Or like, here's my OCD. And they show their like organized closet or something like that. So I think that's a common misconception because people who really struggle with this disorder, one of the sort of like main differences is how distressed they are and how much it interferes with their life. Like all of us, mental health is sort of on a continuum, right? So we all can relate to certain aspects of anxiety, depression, OCD, et cetera, different things. But what makes it a diagnosable mental health disorder is when it causes a lot of distress and interference in your life. So OCD, folks who struggle with that have intrusive thoughts, so they'll have a thought or a feeling come in that feels like, you know, they don't relate to it. It feels intrusive, like they don't want it, right? And the compulsions, that part of it is there's something that they feel like they need to do to try to almost answer that thought. And for folks with OCD, like they don't want the compulsions. They don't enjoy, it doesn't make them feel better in a way. It's like they feel like they have to do it. They feel compelled. And I think in some ways it's because the distress that they're feeling about that intrusive thought, it's like how you and I would think about like there's a train speeding towards me, right? It feels dangerous. Like they feel distressed. They feel like they have to do whatever it is the way. And so some situation we might see as neutral, they see as really distressing. So, we might have somebody who, say, is a college student or something like that, and they're trying to do, there's lots of different forms of OCD, and the cleanliness and contamination one that most people know is only one type of OCD. So it can show up, like someone's like doing their schoolwork and they feel like they've got to reread everything to make sure it's exactly right. And so it's taking them 3 times as long to do the homework assignment that somebody else does because they feel like they have to keep checking it, or they start to write something and they erase everything and start over because it feels like it's not right. So there's lots of different versions. It affects people's relationships. Sometimes people have such doubting connected to their relationships and they feel like they're always having to ask someone to, is everything okay? over and over again. It gets in the way of their relationships. Some people have really disturbing, intrusive thoughts, like they're worried they're going to murder someone and they're just like a regular person that has no history of violence or anything. But their compulsion is they start to feel like they need to stay away from their loved ones or like hide sharp objects. And they're doing it because they're so distressed, but it's that intrusive thought. So OCD is it's not as common as some of the other disorders, maybe like 1 or 2% of the population, but it can be so impairing, and the people who have it really suffer a lot. So but it's treatable. And so getting treatment is important. And, there's programs like our program at Rutgers that can help.
You talked about a lot of students with these disorders and how they might be struggling themselves, but what are some early signs that indicate that it might be helpful for these students to seek support from a trusted adult or a mental health professional?
Yeah, great question. Because I think, one of the first things is talking about it, right? If you really feel like you're struggling with something or something feels like it's so much harder for you than maybe it should be or that it seems like it is for everybody else, it's, because I think a lot of people, none of us really know what's normal, right? And so sometimes you don't even know that something is not the way other people, like that not everyone feels like they have to redo something 12 times. Um, but if you're feeling like you're struggling and you're feeling really overwhelmed, sometimes really the first step is to talk to someone about it and to not feel like you're alone or you're the only one that's going through things. Because the truth is, you know, we see people, children, adolescents, adults, every single day in the clinic, and they're folks who are out there going to school, working jobs, living their lives. Like nobody would know from the outside how much they're struggling. And, it's just the fact that somebody, like, they heard a podcast or they heard someone else talking about treatment that they got. And, like, so some part of it is like, is knowing that you're not alone. And as you said, the people that you trust in your lives, whether it's your guidance counselor, your parents, friends, etc., starting to talk about it, and knowing that there's help out there, and that sometimes those trusted adults can help you find treatments that work for you.
Okay, so we have like 5 minutes left. So we're going to end off with a couple more questions. So our next question was, how do mental health professionals determine what kind of support or treatment that may be most helpful for someone depending on what sort of symptoms they show and stuff?
Yeah, great question. I think it's a little bit different depending on the provider or the practice, but I can tell you what we do at our clinic at Rutgers. And the first thing is we just do a phone screening, and we just hear about the problems a little bit in like a short way. And we just try to figure out if we think the person is a good fit. So if they call our general clinic, our clinic coordinators, who are graduate students, talk to them, talk to the person, and they might even feel like one of our specialty clinics is a good fit, and they'll help them to get connected with that clinic. The other thing that we sometimes do is, so the phone screening is kind of the first step, but at our program, we do like a very detailed intake where we ask a lot of questions and gather a lot of information. And that kind of helps us to figure out what we would recommend. If we think our clinic can help, if we think a different clinic can help, what kind of treatment we think can be helpful. And we explain that to the person. We talk through, this is what we think is going on. This is the treatment we think will help you. This is what it's like. This is what you could expect to do. Like, how does that sound? And, obviously the person can decide if they feel like it's a good fit for them, but we all gathering lots of information and asking a lot of questions and trying to get examples of what the person's going through. And we use like questionnaires that have been designed through research to be able to ask the right things, so that we can get the information that we need, and it helps us to make a more informed decision.
Dr. Quinn, at NYNO, our mission is to increase awareness about brains, mental health, while reducing stigma. So why do you think education and awareness are such important parts of improving mental health outcomes?
I mean, I think it's crucially important. It's kind of similar to what we were talking about before. I think these problems can really grow and get worse if a person feels like they're alone and that no one will understand how they feel or no or people can't or not going through similar things. And so I think having information is so important because you may then hear from people who are similar to you. Oh yeah, I struggle with that too, or someone I know struggles with that, or I heard this, podcast and it was talking about this. And so I think that's the type of thing that can, number one, I think it helps people feel more normal and less alone. Like lots of people deal with this. And I think the same way we would get help if we were like sick or had a physical injury, we can get help for mental health things too. There's treatments out there that help. So I think that education is really important. And so I think like that can kind of be the first step to people feeling like you know, they're not so different than other people, and that like mental health is like a part of how we take care of ourselves the same way we take care of our physical health.
So for our last question, if our listeners were to take away just a few, like one message from today's conversation, what would you want it to be?
I think that part that we were just talking about for me is maybe the most important thing. I really, in our clinic, we were really trying to talk to even people who have gone through treatment with us to try to say to them, remember, like your mental health is important too, and it's just as important as your physical health. So, like, for someone coming in the door the first time to feel like they're not alone, but also for even someone who's gotten treatment to feel like you don't have to be in crisis to ask for help with your mental health. Like, I think the stigma around getting therapy and clinical and mental health services is decreasing with your generation, which is great. I think people are talking about it more, normalizing having a therapist, going to therapy. It's something that when I was growing up, no one talked about. It was this idea like you had to be like really, really in crisis to have to get therapy. I think that's changing. And I think that's really important. So it's like even people who go through therapy, we say to them, if you had a condition and you went to a specialist and it got better and then the condition came back, you'd go back to the specialist. So if you need help, come back to us. And maybe, you need a sort of like a little booster or something like that. So I think that's the message I would want people to take more than anything is mental health is health too.
Yes. Dr. Quinn, thank you so much for sharing your experiences and insights with us today. We really appreciate you taking the time to join us and to help us launch the very first podcast episode of MindWaves.
I'm very happy to help. I'm happy to
Thank
help. I'm happy
you.
to talk to you today.
As we wrap up today's episode, I'd like to thank Dr. Andrea Quinn once again for joining us and helping us launch the very first episode of MindWaves.
One message that stood out throughout our conversation is that understanding matters. Whether it's learning about psychology, supporting a friend, or simply taking the time to listen, small actions can make a meaningful difference in someone's life.
At NYNO, we believe that awareness is the first step toward compassion. The more we understand mental health and the brain, the better equipped we are to create communities where people feel supported, respected, and understood.
Thank you so much for listening and being a part of this journey with us.
If you enjoyed today's episode, be sure to follow MindWaves and stay tuned for future conversations with professionals, advocates, researchers, and community leaders who are helping shape the future of mental health awareness.
Until next time, keep learning, keep listening, and keep making a difference.
This is MindWaves, a podcast by NYNO. This is just the beginning of what we hope will become a growing platform for conversations about mental health, neuroscience, and the stories that bring us together.
Thank you.